Welcome to Spread the Facts, tips for older adults and their families to stay home and stay healthy. This is the fourth in a series of Teach with TVW Connect sessions we're presenting in partnership with the Washington State COVID-19 Joint Information Center and AARP. I'm David Johnson, TVW's Director of Education, and today we're connecting with Dr. Tatiana Sadak, Associate Professor of Geriatric Mental Health Nursing at the University of Washington, and Dr. Erwin Tan, Director of Thought Leadership at AARP. They'll be answering questions from older adults dealing with isolation and loneliness during the coronavirus outbreak. Dr. Sadak and Dr. Tan, thank you for joining us.
Thank you.
Dr. Sadak, can you tell us more about your teaching specialty at the University of Washington and how it might have changed during the outbreak?
Thank you for this question. Our whole educational approach is very rapidly evolving. And, we choose to look at a very positive side. COVID pandemic forced us to adopt technology that was maybe in our 5 to 10 year plans to fully integrate. And with unprecedented speed, we're really embracing virtual teaching and learning, virtual simulation, and very creative ways to teach our students nursing, which is very applied clinical practice.
Well, thank you. Dr. Tan, can you tell us more about your role as the Director of Thought Leadership and how coronavirus might have affected your position?
So thank you very much. The issue of coronavirus has really focused our work on trying to get the best information to our members and the public at large. There are a lot of issues that relate to the health of an individual, whether it's the medical questions, but also the social questions. And what we're trying to do is create a website, aarp.org/coronavirus, where people can get the most up-to-date information in a way that's readable and understandable.
Thank you. Dr. Tan, what is your sense of the size of the issue as far as loneliness and isolation among older adults during this outbreak?
So loneliness and isolation are two very important issues that we know from a recent National Academies of Science, Engineering, and Medicine report that can impact the health. A previous study had shown that being lonely or socially isolated was the equivalent of smoking 15 cigarettes a day. And even before the COVID-19 pandemic, we estimate that about 40% of older adults were experiencing some form of loneliness or social isolation. So this is a problem throughout our country, and it has a big medical impact.
And Dr. Sadak, we hear the term a lot, social distancing. Can you talk about that as far as in relationship to isolation? Does that mean that folks should be isolated?
So great questions. Folks should be isolated in the states that mandate social distancing. But I think now we're coining a more appropriate term, which is physical distancing, that does not at all imply social distancing. And I think it's important to clarify terminology. Social isolation and loneliness are perceptions of being alone in this world. You can be in the middle of Times Square surrounded by thousands of people in a pre-COVID pandemic time and feel lonely and socially isolated. You can be in the middle of a family gathering and have perception of social isolation and loneliness, where social distancing and physical distancing, they're changes to our lifestyle that are necessary right now to keep us safe and to get ahead of kind of managing the pandemic. So it's very important to distinguish those terms.
Great, thank you. We have a lot of questions about this issue. So let's go to our first question. This question from Keith.
I'm Keith Lindis from Brier, Washington. Would you talk about the risk factors for social isolation?
Excellent question. So we know that at least 40% of more of Americans of all ages report experiencing some loneliness and social isolation before the pandemic started and physical isolation became mandated. So we don't have current statistics right now on how many people feel impacted, but we could extrapolate that significantly larger number of people would experience perceived sense of loneliness. And we know that older adults are at higher risk. It's also really important to remember that not everybody has access to internet, not everybody has access to tablets and smartphones, and older adults are a group that probably have less of an adoption rates of the technology than any other generation. So we would expect that older adults would feel more disconnected from the outside world when they're not able to physically join in outside world activities.
Great, thank you. Dr. Tan, would you mind discussing some of the short-term and long-term consequences of intense isolation?
So social isolation puts you at risk of actually dying. So it's not only in your mind. We are, as human beings, very social creatures. And when we feel lonely or when we feel isolated, that can be as much as the equivalent of smoking 15 cigarettes a day. And it affects your risk of depression. It also affects your ability to do physical activity. Much of the great physical activity we do as people are often with others, and other people often provide that motivation. And the similar way, being able to take care of your stress during being able to take care of oneself during this time of immense stress often requires that we share our burdens with others. And this is especially the case as many people are experiencing serious illness or even death. And when we're grieving, that's a natural time for all of us to come together. And yet at this time, this inability to have those traditional rituals such as funerals and wakes, that makes us all feel worse and puts us at more risk for complicated grief down the road.
All right, thank you. We do have a question coming up regarding grief, so we'll get into that in a little more depth a little later in the program. But let's go to our next question. This is for Dr. Tan, too. This is from Zelda.
I'm Zelda Foxall from Seattle, and my question is, what are the warning signs that problems are developing?
So I think, making sure that you are in contact with your regular primary care provider is an important piece in this. And even before you are worried that you actually might be infected with COVID-19, this is the time to reach out to your family and friends. Have a plan. Know what will happen if one of you is infected. Have a plan in terms of who's going to check in on you, making sure that, especially for family members that don't live with anyone, having some way of regularly contacting them is going to be important. And as Dr. Sadak said, sometimes that may not be a video call, but it might just be a simple phone call. The other piece is to consider, in your home, how will you take care of yourself? Do you have enough medication? All these things are important conversations to have before you even suspect that you're in trouble.
And I want to kind of continue this conversation and talk about more of a clinical warning signs that loneliness is kind of expanding to potentially endangering your well-being. I want to quote work by John Cassiopio, who was a scientist who really developed this amazing body of research looking at cellular and genetic effects of loneliness. And his teachings, his research demonstrated that loneliness is a really important biological machinery. This pain of loneliness is as important symptomatically as severe thirst or hunger or physical pain, because it's letting us know that we need to pay attention and we need to make adjustments. And some of the very early clinical warning signs that you might be getting in trouble and that your whole being is being out of balance and homeostasis is interrupted sleep. There's a term in sleep medicine, kind of thinning sleep. You are not sleeping as deeply, you're not waking up feeling as restful. And then sequelae of sleep, we now say that the best vitamin for building your immune system is sleep, and that we need to do whatever we can to protect and guard our sleep. So if your sleep is starting to get affected, I would definitely pay attention. And again, then we start this whole chain of events. We're looking at what is your routine like. Now, if you're at home, if you don't have regular activities outside of home, are you still trying to wake up at the same time? Are you going to bed at the same time? Are you eating regular meals at the same time? Are you engaged in physical activity? So I think one of the important early warning signs would be to pay attention and to improve your sleep.
Dr. Sadak, I'd like to go on, discuss grief a little bit more in depth. What are some suggestions for folks to deal with grief and anxiety during the coronavirus? And what changes might we observe for folks that are dealing with this grief associated with the virus outbreak?
I want to recommend a wonderful new book that was conceptualized and written before the pandemic, but is extremely relevant right now. And I think will give the viewers a lot more in-depth kind of guideline on how to address anticipatory anxiety and grief. And it's a brand new book by Dr. Sestern, and it's called Emotional Inflammation. It's a very interesting concept. As you know, we're learning about, some catastrophic physiological responses to COVID is cytokine storm and inflammation in the body. This new book is talking about emotional inflammation, and it's talking about the effect of anticipatory anxiety. So you don't have to be affected with COVID. You don't even have to know anybody personally who is affected to have very high level of fear and to develop post-traumatic stress reactions just to watching what's in the news, just to imagining what could happen to your life. Financial worries, health worries, they all really compound, and they put us at high vulnerability for developing this emotional inflammation. So, and again, we go back to basics, right? How do we combat it? We make sure that our routine is optimized. We make sure that we're eating as healthy as we possibly can, that we reduce or eliminate alcohol and nicotine, that we minimize sugar and flour, that we are engaging socially as much as we can. But most important secret for combating this emotional inflammation is service. Getting engaged in developing new meaning in your own existence. I think Nietzsche said that he who has a why can live to bear almost anyhow.
Mm-hmm.
So what social sciences are showing us is that when you're at the state of high anxiety and worry, that in addition to mindfulness, gratitude, routine, and everything I mentioned, finding ways to be of service and reaching out to somebody else can make the most meaningful and impactful shift.
I just wanted to add to what Dr. Sadak said. I think that's so true. Prior to joining AARP, I was at Johns Hopkins, where we studied the health benefits of volunteering through an AARP foundation program called the Experience Corps program. And although that program is temporarily on hold because of the COVID pandemic, what we found is that service can improve your health. It can even, among the men, we also saw that it actually had brain health improvements as well. But I think that, I think what Dr. Sadak said, that grief has physiological impact on our health is very important. It can affect our physical health. The mind and the body are very connected. And grief is not only a sense of what you're feeling, it's the process that we're going through whenever we have loss. And speaking as an immigrant who's Asian American, I know that within our Asian American community, sometimes people have a stigma against mental health and seeking out mental health. But yet when someone dies, like when my father died, I was able to express my sadness and receive, condolences from my community. And in a similar way, we've lost not only loved ones, but some of us have lost our jobs, some of us have lost our communities, our sense of purpose. And those are reasons people grieve. And it's important to realize that we all grieve in different ways. Sometimes it's sadness, sometimes it's being angry or withdrawn. But in seeking help, we can also take better care of ourselves and our family members. So I would take this idea that, we allow ourselves to grieve for those that we love. We should also take care of ourselves now, because we are all collectively grieving for the many things that we have lost.
Absolutely, this is so important. And for older adults, especially losing that sense of autonomy right now, having fear of going to the grocery store, right? We all need to buy supplies, but even having to measure out risk versus the necessity And I think it's important to, so how do we respond to this grief, right? How do we respond to this global perception of loss of autonomy and loss of control? And, there's three simple steps. One, you recognize it, and that's the most important step. You have to acknowledge it. You can't go as usual, even if before the pandemic you were fairly isolated and haven't gotten out much and haven't done much, you still need to recognize that this is affecting you. Things shifted. Before, maybe you chose not to do as much. Right now, this choice was taken away. So to recognize and to process what does it mean for you mentally and emotionally is an important step. And then to understand how does it affect you. And then to try to have some degree of autonomy in how you respond. And one example that I think might be most useful to our audience is to really choose your worry time. If your morning routine and day routine and evening routine are centered around constantly scrolling internet, having TV playing in the background, you become what you pay attention to, right? You become this ball of worry and fear. There's a wonderful app. If you have a smartphone, it's available on Android and iPhone. It's called Worry Time. And it's the simplest thing. I thought it was silly, but it's amazing. You identify a thing that kind of worries you all the time, and you set time in a day you're going to worry about it. And the phone beeps you and say, okay, right now you have 5 minutes to worry about this. And you can set it every hour. You can set it once a day. It's amazing how powerful that is to set the time for when you worry. So I encourage everybody to really set the time for when you look at the news. And please don't do it right before bedtime, because then you're going to start interfering with your sleep, right? And maybe don't do it first thing when you woke up, Focus on getting sunshine first thing in the morning. Focus on your nutritious breakfast, some physical exercise, and then limit the time for when you are allowing yourself to worry. And if you are watching TV or if you're looking at the internet, you're going to worry because the news are designed to give you some of the most worrisome information. So maybe best ways to keep up with what's happening in the world is to look at CDC, look at World Health Organization, Washington State Department of Health, to have more of a neutral information and statistics versus this kind of worry element that you may see on regular TV channels. But whatever you do, please limit it and don't create this whole new habit and lifestyle around tracking of what's happening around the world.
My understanding is not uncommon for a lot of folks to just have cable news kind of going in the background, a lot of time almost as a way to combat loneliness and isolation. The news is kind of a friend they have playing in the background. If they shouldn't be so much tuning into news sources, what are some other suggestions for folks?
I think we're going to be providing you with some links to ample amount of things to do right now. And now the positive of this pandemic is almost every organization, every institution opened up their resources to everyone. Cirque du Soleil, operas are broadcasting the shows. Almost every university is making some of their self-paced, self-learning courses available. Here in the state of Washington, there are special programs for people living with dementia and their caregivers where you can go on a virtual tour of the zoo and talk to zookeepers, where you can go on virtual tours of gardens. There's so many things to do. So why not take this time as an opportunity to improve yourself, to learn, to master a skill you never mastered, and to really kind of focus your attention to something more creative. Do keep up with what's happening in the world, because you don't want to be living in fear of ignorance, right? Because sometimes our mind can create even more worry, but limit it and balance it with other more creative activities. And there's plenty of them if you have access to the internet.
And some people will even keep their a video on with a family member from far away as they're doing their routine activities of the day. And, it allows you to, thinking about chopping the vegetables with someone next to you, but they just might be doing laundry, and then as something comes up, you talk to them. So you have that connection throughout the day. AARP.org/coronavirus also has a lot of links, from exercises you can do at your home, or mindfulness meditation videos that can also help you relax. We also have information on grief, and even one article that talks about what couples can do And in terms of like thinking about service, an idea that Dr. Sadak said, this is also an opportunity to come to help the other people you love who are close to you. And there's even the potential for people to become closer to this process.
Absolutely.
I'll ask this question to both of you, but I'd like to start with Dr. Tan. Dr. Tan, for folks that are interested in service, but don't know where to start, do you have any suggestions for someone who could begin to look into that?
So AARP recognizes both the need and the value of service. And now at this time, we've developed this Community Connections website, and the link will be provided for you. And this will allow you to seek help if you need it. Also provide you opportunities to provide help to your neighbors as well, all in a safe way that allows you to maintain physical distance.
Thank you. Dr. Sadak, do you have any suggestions for local service resources?
Right. So State of Washington Department of Health are expanding their warm line that is going to be staffed with some semi-professional counselors, professional counselors, and volunteers. So that might be a good way to look for an opportunity. Alzheimer's Association of Washington State and area agencies of aging, there would be really good places locally to learn about volunteer opportunities. National Institute on Aging also has this wonderful service. It's called the Friendship Line, and we will connect it in comments later on. The link to it. Friendship Line was specifically designed for people over 65 if they feel lonely and isolated and they wanted to talk to peers. So a lot of people who are staffing those national lines are also older adults or people who really understand specific challenges older adults are facing.
All right, thank you. Let's go on to our next question.
Hi, my name is Kay Tomlinson, and I'm from Lake Tapps, Washington. I know a lot of people are using Zoom and FaceTime now to keep in touch, but what options can you recommend for those that we care for that really don't have access to that kind of technology so they can keep in touch too? Thanks.
An excellent question, very important question. Thank you for asking it. Again, you know, the survey shows that probably 1/3 of older adults do not have access to smartphones, tablets, computers, and or internet. So it's really important for us not to say rely on technology and internet as the only options to stay in touch. So some ideas are, what a wonderful opportunity to revive an old craft of letter writing. You know, reliably, you know, write and mail a letter, you know, every week and give the old adult you care for something to look forward to. Set up a routine phone call. Most people have a landline, and it's so important, you know, for your care recipient to know that at 6 o'clock that phone would ring. And a lot of times this whole routine of this person would be built around, you know, this phone ringing at 6 o'clock, and try to be consistent again as you're helping them to set up their routine. Engage your children and grandchildren in those phone calls. And if there is some access to technology, but older adult doesn't feel comfortable yet using it, what a great opportunity is. Our kids and grandkids are out of school right now. Give them a project. Give them a project to coach and to, you know, train their grandparent over, you know, technology to how to best use it. Again, if there is access to technology but lack of skills, there's many companies right now that create special laptops and tablets for older adults that only have 1 or 2, 3 buttons with certain things programmed and loaded in them. But if there is no access to technology at all, there's so many ideas. You can read to your loved one over the phone, over the landline. Some churches are holding church services that you can call into, which is really important for many people because they feel very disconnected from their faith community. It's just kind of looking for those opportunities and remembering what did we do 10, 15, 20 years ago, right? And bringing back those best practices and putting them into everyday life. But I think most important thing in terms of long distance caregiving is consistency. And for your care recipient to know that you're there and that you're reliably and consistently there for them.
One of the things I've done is I've reached out to my neighbors to make sure that their relatives, especially if with my older neighbors, that their relatives have my contact information as well. So if if one of their children has difficulty contacting their parent, they can always reach out to me, and I'll be there just across the street.
Dr. Tan, I wonder if you could talk about how someone can cope when they lose someone due to COVID-19 with restrictions, on physical distancing restrictions. What are some suggestions or what are some strategies that folks can use when dealing with this kind of loss?
So we all deal with grief differently, and that's important to recognize. But the important piece is also, as Dr. Sadak said, is to recognize it, acknowledge it, and being able to talk about it is the first step. The other piece is reaching out. And while we naturally reach out through rituals such as funerals and wakes, we need to find alternative rituals, whether they be private rituals or whether they be virtual rituals or just reaching out over the phone. Telling stories of the person you've lost with friends and family allows you both to honor your loss and the people that are gone. Making sure that you take care of yourself is an important piece. Often people would deliver food to people who've lost loved ones, but making sure that in addition to food and sleep, as Dr. Sadak said, also as Dr. Sadak mentioned, making sure that you exercise regularly and get some fresh air. And if you even if that means just opening the window in the morning and standing at the window, letting the morning light come in and greet your face, these are all important pieces. But if you do have more serious difficulties from grieving, on the links below, there's also helplines for yourself or someone that you're worried about, because I think it's important to recognize that, especially at a time like a disaster like we're in right now, grief can become complicated, and seeking mental health services is something that we all need to do to protect ourselves and our families when we're having difficulty.
I want to add just a little bit. Dr. Tan did a beautiful job kind of outlining steps to take. And I want to just give a suggestion to family members or caregivers of an older adult who is experiencing grief and loss. I just want to encourage you to remember that many older adults, especially people from different cultures, they associate quite a bit of stigma with acknowledging that they're depressed, with acknowledging that they're really suffering from loneliness or grief. And they may have difficulty talking about it because in their mind it may be associated with weakness, with not being well enough and not wanting to put burden on somebody else. So as Dr. Tan said, sharing the stories, initiating the conversation and talking about your own grief and how you're dealing with this and what you're doing to address it can be very powerful to kind of normalize that this is the behavior that we engage in, and to share with your loved one how you're benefiting from engaging in the behaviors that Dr. Tan described as recommended can be very powerful in moving somebody forward. And another kind of reminder is that right now, Medicare, Medicaid really lifted restrictions on telemedicine and made it much easier for providers to offer this service. And in my clinical practice, all my patients are older adults for the most part. My oldest patient is 105. And when I started seeing patients remotely, I was very concerned. I said, how is this all going to work? FaceTime, Zoom, is it even feasible? And I had very few issues in being able to connect for several months now with my patients remotely. And we've done some deeper therapy than sometimes we haven't done face-to-face because my patients feel probably more comfortable in their home and they were able to kind of ease into it more. So just from my very small, limited personal experience, telemedicine and telepsychiatry with older adults can work very, very well. And please do engage this type of service and engage it early. We know that depression is neurotoxic. When somebody stays majorly chronically depressed for a long period of time, they will experience executive dysfunction. They will experience memory issues. So it's really important to address it early on.
All right, thank you. We'll stay with you, Dr. Sadak, for the next couple questions. We have some questions related to testing. So let's go ahead and play the first question related to testing.
Thank you for taking our question. I'm Robert DeWald. My wife and I recently moved into Emerald Heights, a life care facility in Redmond. We would like to know when communities like ours will rise to the top of the priority list for the coronavirus testing.
Excellent question. And if you want to get more detailed information, a good place to call would be Department of Health for the state of Washington COVID information line. We'll provide a link below for you. But I'll tell you some general thoughts and guidelines. So communities, long-term care communities, assisted living and independent living communities that get priority testing are the places where there's been symptomatic or confirmed COVID case. So once we have a suspicion that there might be a COVID infection within the community, or once it's confirmed, then the testing will come into those settings. And the testing is every day becoming more and more rapidly available. We don't recommend testing people who are completely asymptomatic and where we have no reason to believe that they've been exposed. Many communities early on enforce pretty strict kind of visitor rules, and they are screening and testing employees. So I'm hoping that the reason why you don't have testing in your community is because you've been one of these wonderful places that had very great strict infection control, and residents are not being ill at this time.
All right, thank you. Let's go on to our second testing question. This is a question from Katy, and we'll stay with Dr. Sadak.
My name is Katy Armagost. I live in Mount Vernon, Washington. My question involves antibody testing. I feel like it would really be helpful if there was a test out there so that people like myself who had an illness in early February, and I'm pretty sure it was COVID-19, if people like myself could find out for sure, then we would be free to move about the community and maybe find a way to help others. And that would relieve a lot of the frustration that we're seeing in the news with people wanting to have everything opened up all at once. Thanks. Bye.
This is a very timely question, because just this morning, the leadership of University of Washington School of Medicine and University of Washington affiliated hospitals announced that they're going to start gradual rollout of antibody testing for the hospital employees who've been working directly with COVID positive patients. And it's a really wonderful program to start with healthcare providers who had known exposures, because it would allow us to really study, in addition to doing similar kind of rollout of the programs around the country, what is the percent of false positive antibody testing? And is there a chance that this virus could be mutating and people could have reinfections? We learned from very early studies from other countries that very small percent of people who had confirmed COVID infection and had antibodies did develop reinfection. Again, the percent is very, very minute, but we've studied very few people because antibody testing is just becoming available globally. So we're going to start testing our healthcare providers. We're going to collect data very carefully, and the hope is that broader use of antibody testing outside of healthcare settings and research will be available very, very soon. Again, all the healthcare innovations, all the testing is becoming, the timeline for making it rapidly available to the public is accelerated drastically. So we anticipate that this would be something that would be available very soon.
All right, thank you. Let's go on to the next question, and we'll address this to Dr. Tan. This is a question from Charlotte.
This is Charlotte Claude, and I'm from Seattle, Washington. My question is, there seems to be no lack of information about the coronavirus. And I want to know, should we take a break from the 24/7 news cycle? And if so, how do we keep informed?
All right, so Dr. Tan, I know we've touched on this a little bit already, but I'd just like to get your thoughts on this topic.
Yeah, I think it's important to be informed, but to make sure that, as Dr. Stocks recommended, to limit it to your worry time. I think that's a great idea. That constant fear that all of us are experiencing, the stress, the sense of loss, we know that that can actually affect how our body responds in terms of the stress hormones that we have in our body, and that can cause serious health problems, as well as we know that people who've undergone a lot of stress, that can affect their telomere length. The telomeres are the parts of our genes that shorten every time our cells divide. And there's evidence that it can accelerate some of the biological processes of aging. So making sure that in addition to keeping yourself informed and the recommendations that we have below, the CDC, AARP's, AARP.org/coronavirus, as well as the local health department, that's a great place to go, but keep it within your worry time. And the other part of your day should be about taking care of yourself, because now is a good time to make sure that you're in the best health you can be. It's always a good time to stop tobacco use, and that's clear, but also regular physical activity, making sure that you're connected as much as possible, whether it's with people or a pet. And then also I would recommend making sure that you're trying to eat healthy food, drink or avoid alcohol, and get plenty of sleep. These are ways that you can protect yourself. And in addition to that, limiting your exposure to news while staying informed.
And if I can add just a small piece to that, very nicely said, Dr. Tan, just really wonderful summary of what we really recommend everybody does. I want to comment on eating and grocery shopping. I've was surprised by significant changes in many of my patients' blood pressure from the beginning of the COVID, and I was thinking it was more of an emotional and psychological stress or fear and all the changes. But I'm also wondering how much the change in diet and reliance on kind of foods with stable shelf life and canned foods that have higher sodium concentration really affects very fragile homeostatic mechanisms of older people who are living with multiple chronic conditions and taking multiple medications. So I just want to take an opportunity to encourage you, absolutely limit your trips to the grocery store. But when you do go shopping, there's a big difference between buying, canned beets that are not packed in sugar or salt, or buying frozen vegetables or frozen fruit from buying canned meats, a very high sodium canned foods. So I think paying attention to that can also really help manage your wellness and to maintain kind of your physical fitness.
Thank you. Dr. Tan, do you have any suggestions for older folks who are trying to maintain a very nutritious diet during this time when it may be difficult to get to stores or stores may be out of certain items?
Yeah, this has been very hard. I think we do have some blogs below that also talk about the SNAP program, which is critical now more than ever, as well as home delivery of meals, which also is an option for people who are having difficulty going out and getting food themselves. These are important lifelines, both in terms of basic nutrition and in terms of sometimes social connection. And it's even more important in many communities who have limited resources in terms of being food deserts, where there's a hard time. What's been in normal non-COVID times, people have limited access to grocery stores as well. So I think there might also be local resources as well, and that's where reaching out to friends, family, or even reaching out to faith-based communities where people can help support each other is critical. Just because we're physically separated doesn't mean that we have to be isolated as well.
So in addition to Meals on Wheels and other services, if you're a long distance caregiver of an older adult who is living in physical isolation, if you can help set up grocery delivery, you can put staple lists together and set it up on recurrent deliveries. Almost all grocery stores are delivering goods right now. And as Dr. Tan mentioned earlier, have conversations with their neighbors and say, my mom is living alone. When you go to the grocery store, she's very worried about toilet paper. If you buy some for yourself, can you buy an extra roll, drop it off on her porch, call us or call her, let her know. So really trying to get creative in a way we can support older adults and not make them feel like they have to expose themselves to risk and danger just to provide for their daily necessities.
All right, thank you. We have an email question. We'll address this to Dr. Sadak. All right, so the question is it safe to bring a caregiver into my home now, or should I wait a while? And this is from Marilyn Rushmer.
Marilyn, it's a very important question. First of all, availability of home health help has been significantly diminished because there's so many associated risks in going to their homes without knowing if people have been infected or currently infected. So if you are caring for your loved one and you feel that you really need help and respite, it would be important to work with the agency from where you're thinking about hiring a caregiver or with an individual provider, and really discuss how to keep you, your family, and them as safe as possible. So the questions I would ask before hiring a brand new caregiver, what safety precautions are kind of part of the protocol of your home health agency? Have you yourself been tested? When was that? I wouldn't rely that much on testing results because you can be tested and shown negative and then have exposure 2 hours later. And really, unless we have very reliable antibody testing, I don't think I would put much stock into that. But asking, do you have some safety protective equipment? Because asymptomatic person can be a carrier, and introducing and if this person is caring for more than one person, so if it's a caregiver who is going into multiple homes, they can be completely asymptomatic. In fact, we know that at least 1/3 of all infection is passed on by people who are completely asymptomatic. So having them wear a mask, having them wear gloves, having them using really good disinfecting techniques would be very important. Having said that, I don't want to discourage you from bringing in a home health aide, because we know that continuous caregiving can be very, very difficult. And right now, when you're at home with your loved one, you are the only person who is providing all care and support. You just have to kind of weigh risk and benefits and ask the right questions before you bring outside help in.
All right, thank you. Let's go to the next question. Well, this will be a question for Dr. Tan.
Thank you for taking my question. What I'd like to know is, how important is having a daily routine and performing a form of exercise during our isolation? Thank you very much.
Dr. Tan, I know we've touched on some of this already, but if you could just talk a little bit more about the importance of having a routine, especially when at a time when the days seem to blend together and we're all kind of stuck at home.
Physical activity is one of the most important things you can do for your health. Regular physical activity, thinking about doing some sort of moderate physical activity for 30 minutes, 3 times a week. And it can be in blocks of 10 minutes apiece. But we know, for example, that being physically active is one of the best protective, being physically active is one of the ways that you can protect your brain health. And now more than ever, when we've lost our routines, that becomes more difficult. And if you're at home, you can be what we call rapidly deconditioned as your regular physical activity drops. So I think it's something that we have to be conscious of and to try to actually physically build it into our schedule. Lots of times people are physically active when they're at work, walking around an office or walking down the street. That may have ended. So we need to replace that and think about doing an inventory of what you used to do and what you can do now. Often it's been hard because people's connections, those social relationships, that running buddy that you would run with or walk with is no longer there. But thinking about maybe talking on the phone while you're doing your own physically distant walks, those are ways to try to connect the social connections with the physical activity. And that is one way to develop that routine. And we need to develop new routines. So I think it's developing, as you're developing an inventory of your physical activity, develop an inventory or friendatory or some kind of list of all the people that you're connected with, and trying to pair those together so that you can help yourself and you can help your friends at the same time.
I want to add to that. I love the term friendatory. I might have to just start using it. That's brilliant. Also, there's so many resources right now available for exercise. Silver Sneakers, Zumba classes are available online too. But my patients often ask me, what is the most effective exercise? And the answer is always the same. The most effective exercise is the one you'll do. It doesn't get any more effective. So if you love gardening and if you have a garden, maybe that's your exercise and your fresh air, and you get on a FaceTime with a family member while you do it. Then like a trifecta, it's amazing. If you love dancing, you get into this online Zumba class, but it's actually like whatever you would do that's most effective for you. So don't sacrifice, the good for the benefit of perfect. Just do something every day, do it in small increments, but try to do what you enjoy doing.
All right, thank you. Let's go to Dr. Sadak again for the next question.
My name is Cathy Clem. I live in Federal Way, Washington. And my question for the guests this evening is, what is the value of resource and support groups for older adults in our communities where we're trying to break isolation and reduce loneliness?
So support groups are so valuable, probably one of the most valuable resources that we have. So my clinical area of expertise is dementia and dementia caregiving. And many of my patients and their caregivers been very engaged in Alzheimer's disease and related dementia support groups. So these support groups went virtual locally and nationally since the beginning of pandemic. And many times I'm learning from my patient that they get such a tremendous benefit from learning about coping from their peers, from people who are dealing with either early stages of cognitive impairment or with caregiving challenges. As clinicians, Dr. Tan and I, we hear a lot of patient stories. We have some learned expertise, but we're not living this day to day. And we can give as rich and as meaningful advice as somebody who is facing same issues. So if you have any access to support group, whether it's online, whether it's on a phone or through any other means of media, please do take advantage of it, especially if you're feeling lonely and if you have some needs that are not being currently met.
Thank you. Dr. Tan, can you talk about engaging with family members? We get a lot of questions about, can folks engage with their grandkids during, this time of physical distancing? And can you discuss the options of doing that and the importance of doing that?
So I have a mom who is turning 80 this year, and she lives about 10 minutes from my sister and her 4 kids, four grandchildren. And because there is a lot of COVID-19 in that community right now, my mom has decided not to be physically distant from her daughter, my sister, and my nieces and my nephew. But that means sometimes on a nice day, my mom will come over to the backyard, stay 6 feet away, and join them for a meal. It means that that someone is always checking in on my mom. That my children, when they're playing piano, will call their grandmother, and they'll play piano for my mom. So there are lots of ways that one can do it. It does become more complicated if you know that there's COVID-19 actively in your community, and we know that different generations respond differently to this. Another way that we've tried to connect is the cousins, and there's several of us throughout the country, regularly meet as well on a video conference call, and we all ask about our aunties and uncles. And now we're trying to support our aunties and uncles and our parents into actually having their own video call as well, sort of what Dr. Sadak mentioned. So I think there are ways to think about not only your own family, but the extended family as well. But now more than ever, it's important to think about those multiple generations, especially if you're living in the same home.
All right, thank you. So let's go to Dr. Sadak for this next question.
Hi, my name is Dori Gillum, and I live in Seattle, Washington. My question is, other than family, what organizations are available to help, and how can I get connected with them?
That's an excellent question, and we will provide you with many different links. One of my favorite sources of information is AARP, National Council on Aging. Alzheimer's Association local and national chapters. And there's a wonderful free service called Elder Care Locator that is managed by Administration on Aging that really has multiple local resources. You can just type in, you're looking for meals, you're looking for financial assistance, you're looking for some help with socializing and finding maybe support groups. So that those are a few websites that would have links to local and national resources, and we'll provide them all for you.
All right, thank you. Dr. Tan, we've had some questions about pets. The importance of having pets during this time or interacting with pets, and can pets be affected by the coronavirus, those kind of things. I wonder if you could discuss that.
Pets are important. They provide both an excuse for physical activity and a very important social connection. About 2 years ago, I actually quit my gym and we got a dog. My children said they were going to take care of it, but I knew that I was going to be the one who walks the dog. And every morning I wake up and it could be raining, it could be snowing, and I really don't want to go outside, but I see these puppy eyes, and next thing you know, I'm getting the harness, the leash, and I'm getting my 15 minutes of regular activity twice a day. So I think it's more important now than ever that to realize that they're of a value as well. There were some concerns that we do see on occasion, non-human animals having positive COVID-19 tests. The WHO pretty early on felt that for dogs at least, that this was likely not infectious, that the dogs were an unlikely source of connection. There have been some recent questions about cats. I'm not sure if Dr. Sadak has any additional information, but I have not seen any additional information as well. I think it's always wash your hands is an important something that every dog owner and cat owner knows, especially when you're talking about the bodily fluids. But they are an important piece of our social networks and our lives. If you are thinking of getting a pet, though, at this time, know that they can be a lot of work, they can be an expense, and you should think about what will happen once the social distancing ends. And I firmly believe that there will be a time when this social distancing physical distancing will end.
I just want to contribute to that, just small tip. When you do walk your dog, ask people not to pet it. I think there's just some very basic new pet hygiene rules may need to be in play nowadays when we are worried about transmission. I have not read any literature about domestic animals, cats or dogs contracting or passing on COVID. So I don't have any evidence to warn you about. In my clinical practice, I'm known to frequently write prescriptions for companion animals because I just learned from my patient that they can make such a huge difference in somebody else's life. This bonding, this unconditional love, companionship can be very important, but you have to consider your own health, your own mobility, and many other things that Dr. Tan mentioned before getting a pet. And if you do have a pet, just follow very simple rules of hygiene and not having other people touching your dog. Probably a good idea nowadays.
And that's, what Dr. Sadak mentioned is true. I mean, if you have an animal, a pet in your home that is not infected, the only way that that animal can be infected is through the ways that humans get infected. So maintaining that appropriate physical distancing it will keep your pets and you safe.
Well, we're almost out of time for this connection, but I wanted to go to each of you and see if there's anything you want to add. We'll start with Dr. Sadak. Anything you want to add that we haven't covered so far?
Well, I want to thank you for an opportunity to share some thoughts about how we can best support older adults during this time. And I just want to really give everybody a call to action. If you're watching this, identify one older adult you haven't been connecting with and reach out. And it's really amazing how the small acts of kindness can impact your life and somebody else's. If you are an older adult, if you are a vulnerable older adult, this call of action is for you too. Identify somebody else and reach out and think of how you could be of service, and then watch the rewards of it multiplying.
Dr. Tan, anything to add that we haven't discussed so far?
So there is idea in physical rehabilitation medicine called prehabilitation. We know what rehabilitation is. That's when after a major illness or surgery, you try to restore what you've lost through physical activity, good diet, sleep, and rest. We can do the same right now. And there's a connection below to a blog that Dr. Julie Silver, who's from Harvard Medical School, wrote about how now is the time to think about being physically active, getting this regular sleep, maintain that or increasing your physical activity. If you can quit smoking, now is the time to take advantage of this. And that is to say that having a purpose, as Dr. Sadak said, is important. And that purpose can simply be keeping yourself as healthy as possible. And again, if you can do it with friends or family, whether people you're living with or people who are distant but connected, still even better. So we all have a purpose. Take care of ourselves and understand that we're all under a tremendous amount of stress. So to give everyone some slack about that.
All right, well, thank you. Well, I'd like to thank you both, Dr. Tan and Dr. Sadak, for joining us.
Thank you, David.
Nice to meet you, Dr. Tan.
Yeah,
Thank you for the work that you do.
Yeah, Dr. Sadak, thank you very much. I mean, I think it's great that mental health is such a key part of this. So thank you for all the work you're doing.
Thank you.
Right.
Thank you. I appreciate your time.
Bye, everybody.
Bye.
That's all the time we have for this Teach with TVW Connect session. I want to thank our guests, and I want to thank our partners, the Washington State COVID-19 Joint Information Center and AARP. For the next Teach with TVW Connect sessions, we'll be discussing the financial impact of the coronavirus outbreak. If you would like to submit questions, please send them to teachwithtvw@tvw.org with the subject line, Spread the Facts. I'm David Johnson. Thank you for joining us, and stay safe.